Hey there, did you ever wonder if there are things for you to do to have a healthy pregnancy and a healthy baby? Well, I'm going to share with you today some things that are really important that you really want to learn about your body. I find that when most women that I talk to really have no idea what's going on with their body, and when the best time to conceive, or even things that they can do to help them not only, increase their chances and their successes of getting pregnant, but having a healthy pregnancy and ultimately a healthy baby, which is so, so important. So, did you know that the most important time for your fertility to optimize your fertility is 3 to 4 months before you try to get pregnant, before you conceive? It takes that long. So we know from Western medicine that it takes about 120 days for that egg to ovulate, and it takes 3 to 4 months for it to develop. It actually starts developing a year. So women are born with all their eggs, and once you start having menstrual cycles, you start losing your eggs. And actually, you start losing them before you have menstrual cycles, but you start losing your eggs, and it takes every time. That's how long it takes to grow a follicle. So even though you have multiple follicles, it can take that long for you to actually ovulate. Isn't that amazing? So that means that you can have such a huge impact on your chances of getting pregnant by, really living a healthy lifestyle. So what does that look like? It looks like, managing your stress, eating really healthy. If you follow me, you know I'm really big on eating a really healthy, nutritious food to nourish your body for overall health and wellness. Because if you think about it, your whatever you're putting in your body, you're getting that nutrition from. It circulates through and nourishes all your organs, and it's going to nourish your eggs. So it's really important. And in order to have really good quality eggs, you need a good oxygenation, good blood flow or circulation, and really good nutrition. Makes sense, right? Doesn't it make sense? So please make sure, please share this video so we can help some people, so maybe some of your friends that want to have a baby, even if they've been trying for a long time. So the people that really want to be doing this preconception care and taking some time is you want to get healthy before you get pregnant. So, and that can look different for everybody. But if you're somebody who is hoping to get pregnant in the next few months, and then you want to start now to getting your body really healthy, getting your hormones in balance, getting everything lined up. We say in Chinese medicine, you need to nourish the soil before you plant the seed. So we want to make sure that you have the best chances not only for a healthy pregnancy, but for a healthy baby. So you want to take that time to make sure that you're going to do everything you can to give it the best chance. And nutrition is a really big deal. So if you're somebody who is trying to have a baby, if you've been struggling for a long time, if you've had an IVF and it didn't work, then you might want to take a step back and look at some different things that you can do so that the next time you have to do IVF, or the next time you do IVF, it's going to work. Your embryos will be viable and it will be more successful. Or maybe you're just getting ready for IVF. Take a moment. Most of the people I work with that do IVF, they usually come after they've had several failed IVFs and they wish they came to see me sooner. But it's so important to do this care before. So if you're thinking of doing IVF and you haven't done it yet, there are things that you should do to optimize your health. Again, from diet and supplements and mindfulness. There are things that you can do to help balance your body, give yourself the ultimate chances of having that IVF success the first time around. And again, there is hope for you if you've had some failed IVF. There's so many things that you can do. So just take some time and really be mindful about what you eat. Make some room, create some management strategies for stress, balance your body. Maybe there's a hormone imbalance going on. There's a lot of different things. Okay, so as far as supplements go, just some basic supplements. I've seen some of my patients have been coming in lately, and they're not even taking a prenatal vitamin. They think that they're supposed to take it when they get pregnant. But again, remember at the beginning of this video, and please share this video, I mentioned to you that it takes 3 to 4 months. It's actually around 120 days for that egg to ovulate. So that's that window of opportunity for you to get that nutrition in there in your body and to nourish those eggs. And that's so once you've already figured out that you're pregnant, it's a little bit late. So if that's the case, you want to jump on board and get on the right path as soon as possible. But in the meantime, get on a good quality prenatal. Make sure that your vitamin D levels are in the right range, that you're not deficient in vitamin D. Make sure that you're taking good supplements. You want to take fish oil, and even though the market pushes DHA, you really need the EPA and the DHA. They're essential fatty acids, and you need both of them for a healthy pregnancy, healthy body, healthy baby. So we want to be on a high quality fish oil. Eating, again, the eating habits, nutrition is going to be huge, huge, huge. Some relaxation techniques, some mindfulness meditations, exercising, doing things to help you manage yourself. You know what? I was listening to one of my coaches the other day, and they reminded me, you need to write, they suggested that I do a not to do list. I said, oh yeah, I remember like years ago you saying that. So I wanted to pass it on to you, a not to do list. So important because there's always so much to do. So if you create a not to do list, you can really focus on the important things that you can do. And maybe that'll help take some stress off for you. Okay, and the other thing that's really important that I wish I knew before I got pregnant was to do a fertility cleanse. So my Prepare to Get Pregnant fertility cleanse is so gentle, and it's really helps remove some of those toxins. I wish that I knew that to detoxify my body before I conceived, because I just passed on a whole bunch of more toxins to my kids. So that's one thing that kind of breaks my heart. But I can help you with that information and let you know that if you have that opportunity to do a cleanse and remove some of those toxins before you get pregnant, because you can't do it when you're pregnant and you can't do it when you're breastfeeding. And you know the ways we eliminate toxins? Through urine, through poo, through sweat, and through breastfeeding. So you want to try to get them out as soon as possible. All right, you guys, that's a lot of information today. Please give me a thumbs up. I really want to give you some value. And if you would like my checklist, my preconception care checklist, go ahead and comment in the comment section below, and we can send that off to you to help you out and kind of revise, do a little review of what we talked about, or maybe even some more information. We'll see you next week. Give me a thumbs up, share this video, and here's to your fertility.